Bone health is a big concern for men with prostate cancer for several reasons. One of them is that the prostate cancer itself can metastasize or spread to the bone, which is probably the most common place that it spreads for this particular type of cancer. And when that happens, it can weaken the bones and make them really at risk for having a fracture, which certainly can cause pain and all kinds of problems. Additionally, bones are important for men with prostate cancer because the prostate cancer makes it weak, as well as the treatment makes it weak. So treatment with androgen deprivation therapy, ADT, hormonal injections, they all mean the same thing. This type of treatment actually weakens the bones over time, very similarly to the way that women develop osteoporosis after they go through menopause. Men in this situation have very low levels of testosterone, which ends up upsetting the hormonal balance that keeps bones strong, and over time they really lose a lot of strength. So men are at risk for fracture from the disease itself, but also because of the treatment. And there are lots of other complications that can happen with bone as well. Bone loss can be prevented, and actually bone density, or the thickness and strength of the bones, can be improved over time. And there are a couple ways to do this. First, men receiving treatments like androgen deprivation therapy, ADT, that hormonal therapy that we've been talking about, can take calcium and vitamin D to help strengthen their bones, and this really kind of builds up the strength of bones. Calcium and vitamin D on their own, however, are usually not quite enough. So men certainly need to engage in weight-bearing activities and exercises. This is not as complicated as it seems. It can mean simply walking around in your neighborhood, spending time on a treadmill, jogging if you feel comfortable with that, whatever activities that involve you moving your body that your doctor will allow. In addition, there are prescription medications that can help strengthen bones, and the major class of medicines that we use is bisphosphonates. These medications really strengthen the bone. They use the calcium and the vitamin D that is already in the system and pull that into the bone to strengthen that density. Typically, we use a medicine called Zoledronic Acid, or Zometa, and that medicine is given by IV. Depending on how advanced the prostate cancer is, it's given either once a year or once every month by IV in an infusion center to strengthen bone. The other medicine that we have is an injection, just a subcutaneous injection, not a muscle injection like hormonal therapy, and that is a medication called denosumab. It's also called Xgeva or Prolia, depending on the way that you administer the medication. And that is given either twice a year or once a month, depending again on how advanced the prostate cancer is. And bisphosphonates and denosumab both work to stop the breakdown process of bone and help the process that builds bone back up. Understanding whether you may be losing bone or diagnosing bone loss during treatment or care for prostate cancer is something that requires a doctor and diagnostic testing. It's really interesting that really it's asymptomatic when you are losing bone mass. You're never going to know or feel it until you end up developing a problem from losing bone mass. In that way, it's sort of similar to chronic diseases like high blood pressure or diabetes that can progress and cause problems over time with patients not really knowing or being aware of it. So to diagnose low bone mass, osteoporosis or osteopenia, which are some technical terms and diagnostic terms for low bone mass, we use things like DEXA scans or bone density scans. And those can really tell you how thick your bone mass is, and it relates your bone mass to the bone mass of healthy individuals so that you have a perspective and an understanding of how at risk you are as compared to people who are healthy, often younger people with healthy bone mass, so you can understand how thin your bones actually are. We can also look at things like MRI or CT scan to get an idea of this, but the best tool is probably the DEXA scan or the bone density scan, especially because it relates it to the bone density of healthy people, so you understand and have a perspective of how thin your bones may be as compared to someone else. In order to get a bone density scan, one has to actually speak with his doctor, or the doctor may speak with you and you order it, just like a regular radiology test or radiographic test. And you simply go to the radiology center, and it's basically a little bit more complicated than a simple x-ray. So it's not invasive, it's not difficult to get, but it is a specific test that needs to be ordered by a doctor. Treatments for bone loss, like treatments for anything, have side effects and risks associated with them. Particularly with bone loss therapies, people can develop low calcium levels because these bone loss therapies take the calcium that's in the blood and incorporate it into the bone mass. So calcium levels in the body can go down as it's really drawn up into bone, and people can have symptoms related to that or heart rhythm difficulties. And so it's important that you make sure that your calcium levels are safe when you're getting these treatments. One of the more feared complications of these medications that's very rare but can happen is something called osteonecrosis of the jaw. And this is basically when your jaw starts to rot or not heal if you have an infection in that area, and it requires potentially multiple surgeries to remove areas or portions of the jaw that are rotting or are necrosing, we say in medical terms, and replace it with healthy bone and potentially healthy skin and tissues over top. And none of us would ever want to have that kind of complication happen in our patients. It's incredibly morbid and causes a lot of pain and suffering. So if someone has dental problems, infections in their teeth, or has required multiple root canals or other procedures in their mouth, they may not get these medications. It's always important to remember that these medications are meant to prevent bad things from happening, and they're not healing or treating something necessarily that's related to the cancer at all. They're really there to prevent complications. And so if the risk is so high for a particular patient that he will have complications rather than prevent them, we usually avoid these medicines. At this point, there aren't specific recommendations regarding a very specific number of months or weeks that one must wait after dental procedures before getting these medicines. I usually like to give someone at least 3 to 6 months after their dental procedure, depending on how invasive that procedure is, before using these medications. Again, these are medicines to prevent bad things from happening, and so I really try to minimize any risk of complication from these medicines. And it's important to talk to both your dentist and your oncologist or your urologist and make sure that they're aware of your dental procedures before you get these medications. Those are not necessarily typical questions that come up in an office visit. And I think if someone's going to be giving you these medications, it's very likely that he or she will ask about dental issues before they give them to you. But in the off chance that they forget or just don't mention it, it's really important for you to think about these things and mention dental work or dental infections or problems with your doctor before getting these medications. People with dentures can use these medications. The problem really comes in when people have either infections or non-healing wounds in their mouths. And so someone with implants and dentures, if there is no infection or ongoing problem in their mouth and it's a stable fixture in their mouth, it's absolutely okay to get these medications.